Hello and welcome to the Monday, June 15th edition of the Situation Report for Thunder Bay Regional Health Sciences Centre's COVID-19 response. My name is Tracie Smith. I'm here with Dr. Stuart Kennedy, who is Incident Manager for our hospital. Dr. Kennedy, so we've had some developments in the community. One is that the Thunder Bay District Health Unit lifted their self-isolation requirement following travel. But we've kept ours in place here at the hospital. So why is there a difference?
First off, I think it's good news that the health unit has sort of made the rule to no need to self-isolate traveling outside northwestern Ontario. Of course, we still does not sort of apply to the United States of America. That border is still closed, but certainly throughout northwestern Ontario and Ontario, I think it's a good move. We got to begin to allow citizens of Thunder Bay to have family over, to have visit their family down in other parts of Ontario. So I think it's a good move because from a psychological perspective, visitations and family gatherings are really, really important. And but certainly we still need to protect our environment here at Thunder Regional Hospital. We have a vulnerable population. We have one acute care hospital, academic acute care hospital in northwestern Ontario, and we need to maintain the function of this facility. If we ever had an outbreak here at Thunder Bay, it would be disastrous to the community. So I still believe that we need to continue to have our restrictions for travel to Thunder Bay outside of northwestern Ontario, that part of the screening process, if you will fail the screen. But we do make exceptions, but only sort of calculated exceptions regarding certain essential care partners. They would be exceptions there, but they have to apply, to the hospital, and physicians who are visiting, doing what we call locums, because summertime's coming, and our physicians here at the hospital will need relief because we do have a critical mass in some areas, so we need relief. But we have a process in place that they have to be approved by the medical staff. They have to be approved by the chief of staff, and then you have to have a quick swab done. And they really cannot be working in any sort of what we call hot zone. So we have a controlled process in place to have a few exceptions. But I think it's very, very important that we continue to restrict this hospital travel from people coming outside of northwestern Ontario for the time being, until we really get a better handle on what the prevalence of disease is throughout Ontario and Canada.
So do you expect that restriction to stay in place for staff for a while, or is that something that is assessed on a regular basis?
Yeah, I think for staff, I think it's summertime also, so we really have to look at that in exceptional circumstances. So again, we're making a policy now regarding exemptions from staff, because they need to also travel throughout outside of northwestern Ontario. We understand that, but we want to make sure we review all the cases to make sure they're not going to sort of a high-risk population. And if they are, we need to know about that and put in certain procedures where they need to self-isolate or begin to get tested because their testing capacity has increased. So we're working on that policy right now. So I expect those restrictions for staff, with exceptions, will be allowed in the near future.
Oh, good. That's good news. And where are we at in terms of pandemic pay? We know that there was an information rally here at the hospital property on Friday. Where are things?
Well, if I was the Minister of Health, or certainly in charge of outlining who deserves pandemic pay, certainly I would not have made the decision they made. I mean, you either give it to all with very few exemptions, or you give it to none, and certainly I don't think the ministry, they're trying to do a good job here to recognize high-risk healthcare employees, but every healthcare employee is at high risk. So I think they made a blunder in one area, that they really cannot dig themselves out of this area, out of this hole. Having said that, once they made the decision, we at Thunder Regional Hospital feel that should be extended to all healthcare workers, and because you just can't reward one without rewarding the others because they're all at risk working in this environment. We've appealed to the Ministry of Health, and at this point in time, which I suspect they're to stay, they're not going to extend or not going to expand the healthcare workers who qualify. So we'll certainly honor the rollout of the pandemic pay that we should be hearing shortly from the Ministry of Health. The timetable is not outlined yet, but we'll do it through our payroll, okay, and our Department of HR will make sure everybody who has been identified with the Ministry of Health gets the pandemic pay that they were promised by the Ministry of Health.
Okay, that's a great update because I believe some people are under the impression that the hospital has received pandemic pay funding and we just haven't distributed it yet, but we haven't received information or funding on that just yet.
Not at this time, but they say it's coming.
Okay, and it's resulted in a little bit of anger. People are frustrated by the inequity of the pandemic pay, and it's sort of another layer of frustration. There have been many things to be frustrated over throughout the course of this pandemic.
Absolutely. If I was one of the healthcare workers, well, of course I am one of the healthcare workers that did not get an increase in their pay, but from my perspective, it's not needed by senior administration or administration. But certainly if I was, on staff here, working in the lab, where there's have significant exposure to patients, working in other sort of departments of the hospital who did not qualify for the pandemic pay, I would be also angered. But you need to, make sure that anger is displaced in a positive way. It's okay to be angry, but you don't want to interfere with your day-to-day functioning. So certainly try to follow the ABCs, allow the anger, let it burn, calm, and then manage your anger. So it's really important to allow yourself the emotions, but don't let it interfere with your ability to have good interpersonal interactions with both your friends and your colleagues and your place of employment. So, again, I would be upset. It's not a fair process, and everybody who deserves the increase in pandemic pay are not getting it.
Yeah, it's very understandable, that frustration, for sure, and really important to acknowledge it and talk about it. So thank you. On to happier things. It's been nearly a week since we began the resumption of some of the non-essential and elective procedures and activities. How are things progressing?
Things are progressing quite well, but again, we're only have increased our service by 25%. That's being maintained this week also. There's still a lot of backlog of elective surgery, a lot of backlog of diagnostics, so it's going to take us months to catch up with that backlog. So we need to move forward with our 50% increase, then 75% increase in these small increments. We have to be methodical about it. We also make sure our drug supply is there, our PPE supply is there. So certainly it's very, very important to begin the movement toward full normal operations in a calculated way. And that's why, I was out this weekend, Tracie, and like everybody, had to do a few sort of catch up in the stores. And I was at a number of stores, and I was very surprised the lack of people wearing face masks. It was actually bothersome because you wear them to protect those essential workers at the stores. You don't want to spread that virus to other workers or employees in the stores and to people throughout that you come in contact with, because it's impossible to stay at that 2 meters distance when you're out at the stores. I mean, you try, but it's impossible. So even though it's not mandatory, it's out of respect for the healthcare profession, out of respect for your citizens of Thunder Bay, that you do wear that mask. Because if a second wave comes, and we have to begin to try to work in an environment without decreasing our surgical capacity again, just think of all the people out there that are still on the wait list for their surgery, on the wait list for their diagnostics. If we have to sort of ramp back down I think it'd be devastating for the health of our community. So I still encourage people to wear that mask. There's good evidence that it works from you spreading to somebody else. Certainly, it's not mandatory, but it's mandatory at our hospital. And certainly, we're policing that as best we can to make sure our employees and staff are wearing that mask. And that's there to protect you from getting the virus. So I think we each have a collective responsibility to wear that mask when you're out in public. And there's no excuse not to have one. They're all over the place. And you can find these masks that protect you from spreading the COVID-19. Even if there's not that much disease out there right now, I think there's only 6 active cases in the community, 3 in hospital, but there still is that potential to spread it. And we need to prevent this second wave moving forward, because our hospital capacity can be fragile. We only have the 1 acute care hospital in the Northwest here as far as academics and teaching, so it's important that we have the respect from each other.
Well, I like that you're using that term, respecting each other. It's really the kindest thing that you can do right now is to wear a mask to protect the rest of the community.
Yes.
So make sure you get out there, get yourself a mask, use anything you have around the house, a scarf, a bandana, anything like that. When you're out and about, wear that mask. Thank you so much. We'll see you soon.
Thank you.